On July 24th of this year, there was a nationwide day of action to demonstrate support for the proposed Medicare for All. 51 cities participated with over 100 sponsors in the coalition. Our local rally had about 60 participants, a great turnout for a sweltering day, especially since there was virtually no mention of this in the mainstream media and publicity was basically word of mouth and social media. There were numerous speakers and much support from passing pedestrians and motorists. Plans are in the works for more actions, as this is a fundamental issue that affects every single one of us. Healthcare is a right, and nearly every developed country in the world has made provisions for the care of its citizens. That is, except for the United States, which appears not to have the will or the courage to stand up to the big insurance companies and hospital corporations. Notably, no country with single-payer healthcare has ever dismantled it in favor of a for-profit system, and citizens of those countries are generally satisfied with their healthcare. The United States spends more per capita on healthcare than any other nation, over $9,000, which amounts to about 20% of the GDP, and yet does not have an equivalent improvement in outcomes. As a matter of fact, the United States ranks 29th in infant mortality and 26th in life expectancy. A staggering 45,000 United States citizens die every year for lack of health care, and medical debt is the #1 reason for bankruptcy in the United States. According to one study, over 60% of all bankruptcies filed in this country are due to medical debt. Surprisingly, the majority of these people had some sort of health insurance at the time. How does this happen? As recently as the early 20th century, there was no such thing as insurance. Medical treatments were simple and by and large of limited success. None of the current treatments that we take for granted, antibiotics, pain medications, sterile surgery, were available, and hospitals were basically warehouses for the dying. Care was given by individual doctors in local clinics for nominal fees. The insurance system as we know it today began in 1920 at Baylor University, where their hospital, founded as a charitable organization, as many of them were, discovered that many of their bills were unpaid. Their lawyers came up with a plan to charge a set amount per month to cover the full cost of hospitalization, after a deductible, of course. This became popular among employers and labor unions and eventually transformed into the Blue Cross system with the later addition of Blue Shield, which was meant to cover non-hospital care. Both of these were what would now be known as major medical plans and were never meant to defray the total cost of health care. At the time, they were still considered nonprofit charitable organizations, but this would change in the 1950s when Aetna and Cigna entered the market. Both were for-profit companies and thus could pick their customers from among the younger and healthier populace. This left Blue Cross and Blue Shield with older, sicker customers and dire financial straits. In 1994, their board members voted to allow the plans to become for-profit entities. The real turning point came in 1973 when President Nixon signed the Health Maintenance Organization Act, which allowed all facets of the healthcare system to function as for-profit entities. This allowed the institution of incentives for doctors to limit access to procedures and to act as gatekeepers for patients who needed referrals to specialists. By the 1990s, only 68% of premiums collected were used for healthcare costs. The remainder was used for administrative costs and to pay shareholders. Before this, the percentage was closer to 90%. This turned healthcare into a commodity, limited to those with the ability to pay the premiums, deductibles, and copays. In addition, the proliferation of patents on newly developed drugs, including Me Too drugs, which are minimally modified from existing drugs in order to justify charging ever higher prices, has put many pharmaceuticals out of reach for the general public. Some of these are rarely used drugs for unusual diseases. Others are critical for day-to-day life for patients such as diabetics. The recent hike in insulin pricing is an example of this. The initial patent was reluctantly sold by the discoverer for $1, as he wanted it to be available to all. But especially in the United States, the major manufacturers are constantly making minor adjustments to either the drug itself or the delivery system, keeping the price elevated. The Affordable Care Act was touted as a great victory for the public, but in reality, it concealed a windfall for the healthcare industry. by mandating that everyone have insurance coverage, which, by the way, is not synonymous with health care. According to Obama himself, his plan was based on one composed by the Conservative Heritage Foundation, although the foundation now denies this. The act did provide insurance for some previous uninsured people, but not only did it still leave tens of millions uninsured, it also allowed insurance companies to raise premiums on a bewildering number of new plans. Since companies were no longer allowed to exclude patients with pre-existing conditions, they compensated by instituting various new levels of premiums. This effectively raised costs for patients who already had insurance unless they wanted to change to a lower level plan. The ACA also requires that insurance companies spend at least 80% of premium dollars on healthcare. This was heralded as a win for consumers, and it was certainly an improvement on the 68% previously mentioned, but nowhere near the 90% that was spent in previous years. And note that Medicare spends about 98% of its funds for healthcare. Insurers fought to keep even the 80% requirement out of the ACA, but when all was said and done, they ended up merely raising premiums in order to keep their slice of the pie consistent. The ACA did nothing to address the problem of gatekeeping by the insurance companies, that is, the requirement that any and all care first be approved by the insurer, and lack of access to even the most basic medical care for a large part of the population. I've told the story many times of how I walked around on a ruptured Achilles tendon for a couple of months while waiting for my insurer to approve first the X-ray, then the MRI, then the surgeon, and finally the physical therapy. As an aside, apropos of inflated costs, the boot I had to wear cost over $400. I later found it on Amazon for $38. Admittedly, this is a relatively low amount of stress on my part. There are people who are in life-threatening conditions and can't afford their medication at all. The ACA did nothing to prevent the closure of unprofitable, quote unquote, hospitals and the increasing corporate takeover of individual hospitals, leaving some hospitals without basic equipment and others with more money than they could possibly spend. Again, I saw this in my own neighborhood in Brooklyn. Our local hospital, which served a working class population, was taken over by a corporation and purposely run into the ground, finally being sold to a developer for luxury condominiums, while another hospital in the same system in a wealthier part of town had enough money to hire an artist in residence and install a sculpture garden. There had been demands for both allowing the government to negotiate prices with the pharmaceutical companies and allowing importation of less expensive medications from Canada. Both of these were removed from the final draft of the Affordable Care Act after intense lobbying from Big Pharma, granting them the right to continue setting their own prices, which kept some life-saving medications out of reach of the majority of the population. This left a severely watered-down regulation that failed to fulfill its stated goal of providing health care to the majority of the United States population. Now let's take a brief look at some of the historical attempts to institute single-payer health care in the United States. In 1912, Theodore Roosevelt made it one of the planks in his platform during his unsuccessful presidential campaign as leader of the Progressive Bull Moose Party. His plan was based on the system that Germany had been using since the 1880s. He lost the election to Woodrow Wilson, and the idea of universal health care basically lay dormant, partially due to anathema for all things German, until FDR proposed it as part of the Social Security system in 1935. He bowed to pressure from the AMA and removed it from the plan. This would be a recurring theme in years to come. A plan would be proposed, the AMA would vocally resist, and the plan would die a quiet death. Harry Truman made a concerted effort to get this plan passed, but the AMA yet again lobbied against it in what has been called the most successful lobbying effort in United States history. Under President Johnson, Medicare and Medicaid were established in 1965. Johnson had many flaws, but he was a supremely skilled politician, and this was done by making concessions to the AMA and congressional Republicans, as well as a lot of arm twisting. Dennis Kucinich has been a vocal supporter of single-payer health care, everybody in, nobody out, for decades, but has been consistently dismissed by the establishment. Forward to 2016 and Bernie Sanders. His plan would dismantle the entire insurance conglomerate and replace it with an expanded and improved Medicare organization. It would include things that Medicare currently does not: vision care, hearing aids, dental care, mental health care, and long-term nursing care. Unfortunately, this plan has been repeatedly smeared as being socialist, which is presented as a dirty word, and expensive, which isn't strictly true. So we have seen that healthcare here is a mess. What do we do about it? There are a couple of options. One would be complete government operation of the healthcare system, similar to the NHS in England, where hospitals and doctors are managed by a governmental body. Another would be expansion of Medicare, which is a more practical option for the moment and the goal of the Medicare for All movement. People on Medicare consistently report between 85 and 90% satisfaction. The administration seems to be much more efficient than the chaotic jumble of agencies and private companies we have now. There's already a framework in place to administer the system, and any lost insurance company jobs could be slotted into the Medicare infrastructure. Bernie Sanders' Medicare for All proposal has been calculated, even by a Koch brothers study, to save the United States about $2 trillion over the next 10 years, in addition to substantially improving quality of life for everyone. The out-of-pocket expense for consumers would also be greatly reduced. For example, those with incomes less than $40,000 would pay a maximum of $20 a month. Compare this with the current average premium of $450 per person, not including co-pays and deductibles, which vary by plan and by state, but in general can range from nearly nothing to for the most inclusive and expensive plans to tens of thousands of dollars, averaging $4,000 to $5,000 nationally. It would seem to be an obvious solution to the dilemma we're currently in. However, because of the apparently unlimited deep pockets of the insurance industry and big pharma, our legislators, unfortunately, even including some of the more progressive Congress people and senators, have been bought off and have backed away from even the weakest support of Medicare for All. The current bill in Congress has 117 co-sponsors in the House, but there are powerful opponents, up to and including Speaker Pelosi. President Biden has also vowed to veto the bill, even if it eventually lands on his desk, both citing cost concerns, which are unjustified as we have seen, and claiming that it would be, quote, disrespectful to his deceased son, unquote, which makes no sense at all. Of course, there are many other opponents in both major parties, and neither party has seen fit to make it part of their platform. There was an attempt to put it on the platform in both 2016 and 2020, but it was thwarted by Sanders' opponents. This leaves the Green Party as the only political party in support, as it has been since its formation. I took the following directly from the Green Party platform. The Green Party supports single-payer universal health care and preventive care for all. We believe that health care is a right, not a privilege. Our refusal to be beholden to corporations and their funding puts us in a unique position to champion this issue. Remember, people before profits, always.